some health insurers ending waivers for COVID treatment fees. Waivers have meant substantial savings for COVID-19 patients who fall seriously ill and wind up in the hospital. Just as other industries are rolling back some consumer-friendly changes made early in the pandemic, think empty middle seats on airplanes, so, too, are health insurers. Many voluntarily waived all deductibles, copayments and other costs for insured patients who fell ill with COVID-19 and needed hospital care, doctor visits, medications or other treatment. Setting aside those fees was a good move from a public relations standpoint. The industry got credit for helping customers during tough times. And it had political and financial benefits for insurers, too. But nothing lasts forever. Starting at the end of last year, and continuing into the spring, a growing number of insurers are quietly ending those fee waivers for COVID-19 treatment on some or all policies. When it comes to treatment, more and more consumers will find that the normal course of deductibles, copayments and co-insurance will apply, said Sabrina Corlett, research professor and co-director of the Center on Health Insurance Reforms at Georgetown University. Even so, the good news is that vaccinations and most COVID tests should still be free, added Corlett. That's because federal law requires insurers to waive costs for COVID testing and vaccination. Guidance issued early in President Joe Biden's term reinforced that Trump administration rule about waiving cost sharing for testing and said it applies even in situations in which an asymptomatic person wants a test before, say, visiting a relative. But treatment is different. Insurers voluntarily waive those costs, so they can decide when to reinstate them. Indeed, the initial step not to charge treatment fees may have preempted any effort by the federal government to mandate it, said Cynthia Cox, a vice president at KFF and director for its program on the Affordable Care Act. In a study released in November, researchers found about 88% of people covered by insurance plans, those bought by individuals and some group plans offered by employers, had policies that waived such payments at some point during the pandemic, said Cox, a co-author. But many of those waivers were expected to expire by the end of the year or early this year. Some did. Anthem, for example, stopped them at the end of January. United Health, another of the nation's largest insurers, began rolling back waivers in the fall, finishing up by the end of March. Deductible-free inpatient treatment for COVID through Aetna expired February 28. A few insurers continue to forego patient cost-sharing in some types of policies. Humana, for example, has left the cost-sharing waiver in place for Medicare Advantage members, but dropped it January 1 for those in job-based group plans. Not all are making the changes. For example, Premera Blue Cross in Washington and Sharp Health Plan in California have extended treatment cost waivers through June. Kaiser Permanente said it is keeping its program in place for members diagnosed with COVID-19 and has not set an end date. Meanwhile, UPMC in Pittsburgh plan to continue to waive all copayments and deductibles for in-network treatment through April 20. What does it mean for consumers? Waivers may result in little savings for people with mild cases of COVID-19 that are treated at home. But the savings for patients who fall seriously ill and wind up in the hospital could be substantial. Emergency room visits and hospitalization are expensive, and many insured patients must pay a portion of those costs through annual deductibles before full coverage kicks in. Deductibles have been on the rise for years. Single coverage deductibles for people who work for large employers average $1,418, while those for employees of small firms average $2,295, according to a survey of employers by KFF. KHN is an editorially independent program of KFF.